All right, class, going on to part 2 of our environmental emergencies and talking about cold disorders. Again, we don't get much experience here in Florida with these guys, so let's make sure that we understand this because, remember, probably 40 of the other 50 states, they do have to deal with these, and you can pretty much bet there's going to be a question or two on your national registry about this. Again, it's below 95 degrees Fahrenheit or 35 degrees Celsius, and what happens is you lose your ability to create heat, and that's the big problem. So again, the exposure to control, you start to conserve and generate heat. Piloerection, it impedes the airflow across the skin. So yes, that it does start to give you goosebumps. Okay. Shivering increases, and then the peripheral vasoconstriction, your skin gets a little bit more pale, if you will. And then when the body can no longer compensate for that, again, that's when the body temperature falls, and it starts to slow down the metabolism. And again, so let's figure out how to make this better. Again, biggest thing is of course, get to a heat source, get rid of the things that's causing you to lose the heat. By the way, health of the patient, if they're hypothyroids, Parkinson's disease, diabetics, fatigue, all of them have trouble with their cold regulation. All right, notice that a bunch of those that had heat problem are also on that list, okay? By the way, drinking alcohol will not heat you up. I want to make sure that you guys understand that. Contrary to the urban outdoorsman's belief, no, unfortunately, gang, it doesn't. Neither does narcotics, okay? It actually cools you down faster. Okay, so by the way, if you got coexisting weather conditions, rain and you got cold and rain, can increase that as well. So remember to dress warmly, plenty of layers, get appropriate eating, and then intervals to support the metabolism and limit your exposure. Okay, usually, by the way, the good news is in Florida here we've only got probably about 2 days of it. So again, mild hypothermia is when you get core temperature greater than 90. And then severe hypothermia is when you get it less than 90 degrees Fahrenheit. Again, extremely cold. If they get down to around 86, 87, you're looking at probably... The biggest problem actually when they get this cold is they can actually have cases of where they go into ventricular fibrillation very easily, okay? By the way, don't try to shock them until you warm them up, okay? If you try to shock them, again, you do your CPR, but you're probably going to need to warm them up before you can actually defibrillate them, all right? That's the phrase, they're not dead until they're warm and dead, or not dead until they're cool and dead, okay? So again, signs of mild hypothermia is usually tachycardia, shivering, a little bit of vasoconstriction. They're going to be breathing fast, by the way, loses more heat. And again, they're going to have fatigue and impaired judgment. Moderate hypothermia, this is where, again, you're looking at 82 to 90 degrees Fahrenheit. And again, this is you're going to have your arrhythmias of the possibility. They're going to have low blood pressure, alter mental status, and they usually lose their shivering at this point. Severe hypothermia, they're usually going to be apneic coma, and again, ventricular arrhythmias or asystole are common. That's below 82 degrees Fahrenheit. Again, they're not dead till they're warm and dead, so you got to keep that. Now, your body, by the way, can compensate. It does produce heat. And again, the core body temperature will still continue to drop, though, okay? So, again, usually it's acute, subacute, or chronic exposures. And again, it may develop secondary to other problems. Again, temperatures below 86 degrees Fahrenheit is a significant risk of mortality. So how do we manage these guys, okay? Again, look for the signs and symptoms, okay? If they're disoriented, confused, consider that they're in severe hypothermia, okay? Again, you can have a little bit of changing lethargy, shivering. Muscles may be stiff and uncoordinated with a mild hypothermia. But the severe hypothermia is the one we got to watch out for. So again, if they're cold, we need to watch their cardiac rhythm, and they are prone for going into VFib. So be careful with that, all right? Again, remove the wet garments. Again, protect against heat loss and wind chill. Bundle them up. Passive external warming usually works really good. Maintain the patient in a horizontal position. Keep them flat, all right? Avoid rough handling because that one could trigger the arrhythmia. Again, monitor the core temperature and, again, your cardiac rhythm. So active rewarming is when you're using warming blankets, heat placed over the area. You're going to place heat transfers there using heat packs. Usually, again, in the back of the neck, the arms are really good radiators there. Again, IV fluids that you use the heat the IV fluids where the fluids are actually warmer than the core body temperature. Again, in Florida, not really done, but up north, definitely you actually keep your. And one little sidebar of that. During your cold months, you need to have a little you need to make sure that either your truck is consistently heated, and I would probably bring in my IV fluids that I was going to use on a patient and keep them in my station just to keep them warm. Because the problem is a lot of times out, if you have the truck out in the bay or out in the outside, you can actually, the IV fluids can get down to around 40, 50 degrees. And even with your heater being on. So you need to really make sure that you've got warm IV fluids going into your patient, okay? So again, make sure, handle them gently, and again, rewarming, again, get the wet stuff off of them, okay? Warmed IV fluids work really good. Again, bundle them up. Cold diuresis. Remember that vasoconstriction causes an increased blood volume in the kidney and blood pressure, and the kidneys remove excess fluid to reduce that pressure. So they start peeing a lot, okay? So keep them warm. Sweetened fluids work really good. Alcohol and caffeine should be avoided, okay? It doesn't make it better. Yes, the Starbucks with a shot of Jameson's does not make it better, okay? So if you're going to have to do a resuscitation, BLS immediately, but you want to warm them up, warm humidified oxygen if possible, warm them up, and then if you're gonna, if the AED is available, the VFib is detected, single shock at 360 joules, and again, rapid transport, and you need to warm them up, okay? Got to warm them up. You got to continue the rewarming efforts. Keep the CPR going, okay? The good news is the cold actually kind of helps us in this because it kind of delays brain loss function due to the lower metabolism, okay? So we want to keep the warming process going, all right? Transport very gently. We don't want to quickly shake or drop them or bump them too hard. And again, because you could have myocardial irritability, they go into VFib on you, okay? And again, frostbite. Now, this is where you got freezing of the tissues, ice crystals form within, and then they expand and start destroying cells. And let me give you a nice little, that's a good example of good old-fashioned frostbite. Yeah, this is necros tissue, by the way. Ew. All right? So again, transport to the hospital for rewarming by immersion. If the transport is going to be delayed, that's when you're going to need to do the 102 to 104 degree, which is the active water bath. Remember, you got to keep it at 102 to 104. Very difficult to do in the back of an ambulance, okay? Cover the thawed parts loosely with applied dry, sterile dressings. And again, usually they will also have hypothermia, so remember, we don't rub snow on the frozen area. Kind of counterproductive. All right, and analgesia, by the way, prior to thawing is probably a good thing to do, okay? And again, trench foot, yuck, right? This is usually happens in our colder, it's above freezing, but it's rarely seen in the civilian population. But in our military guys, especially, again, it's usually due to the wet socks and cold environments, okay? The symptoms are very similar to frostbite, and it can be extremely painful. The blisters form on the outside of rewarming. So again, dry, warm, sterile, aerate the foot, elevate, and then avoid the prolonged exposure to standing water, okay? Again, keep your socks dry, okay? And never sleep in wet boots or socks. As dumb as that sounds, that's probably true. So especially like when you're going into these regions in the cold time where you're doing flooding operations, actually trench foot has been one of the problems that our response teams have actually found. All right, that's going to do it for this one. We'll get started on drowning on the third part. We'll see you then.